Welcome to All in Adams, the official podcast of Adams County government, where we're all in for our residents, our employees, and our community. So whether you live here, work here, or you just want to know more about what makes Adams County a great place to be, thanks for tuning in. We're all in, Adams.
Hello, and welcome to another episode of All in Adams. I'm Jennifer Lucero Alvarez, Strategic Communications Manager for the Adams County Health Department. And I'm so excited to introduce to you today two individuals, members of our leadership team, who play an instrumental role in providing you the most accurate and up-to-date health information to help you keep you and your family, as well as everyone in Adams County, safe. First is Dr. Wendy Bamberg, our medical officer, who joined us a couple months ago, and Valencia Bautista, who has been with us since we opened our doors in 2023, but has recently been named our new Nursing Director, and we're so excited for that, and so thank you so much for you both being here today. Dr. Bamberg, I'll start with you, but before we get into the work, why don't you tell us a little bit about yourself, where you were before you joined Adams County, and what drew you to public health, especially here in this county?
Yeah, so I've worked in governmental public health for about 20 years now, and I've been at the local level like Adams County or at the state level for most of my career. So I most recently came from the state health department here in Colorado. And just prior to that, I was in Melbourne, Australia, working at a local agency similar to Adams. That was during the kind of the height of COVID. But overall, I've been in governmental public health for, like I said, a couple of decades. So originally, I got into public health because I was post-medical school and in training for internal medicine, which is like adult medicine and infectious diseases. And during that training, I had a mentor who was able to get me a rotation at the public health department where I was doing my training. And I absolutely loved it. There was an outbreak of listeria that was going on that was eventually tied to turkey deli meat. And listeria is something that can make you really sick. And so there was a lot of emphasis on kind of trying to find the source. And I was working with a couple of people there who were doing this training program through the CDC called the Epidemic Intelligence Service. So it's like disease detectives. Think like Kate Winslet in Contagion, that her role was actually based on the Epidemic Intelligence Service. And I thought, this is really cool. I really want to do this. So I was lucky enough to be able to do that training, and I've been in public health ever since, and I've loved every minute of it. As far as coming to Adams, I'm really excited actually to come to Adams because I grew up in unincorporated Boulder County. So for me, this is like coming home. And I've always loved working at the local level because I really like working with communities, and the local level public health really gives you an opportunity to do that. So I'm very excited to be here.
Great, thank you. And Valencia, you've been with ACHD since we first opened our doors over 3 years ago. I can't even believe it by now. Now you're managing our largest public-facing division. What has that journey looked like for you? Both professionally and personally?
Yeah, being part of Adams County Health Department's journey since the beginning has been incredibly meaningful. I started with the health department when we were only about 3 months old, and opportunities to help build an entirely new health department from the ground up were incredibly rare. So that was something that was initially really inspiring and motivating for me. Before being at the health department here, I was working at another local public health agency out of state, managing and overseeing our clinical spaces and navigating through the challenges of the COVID pandemic. So professionally, that period brought a lot of new experiences all at one time. So in many ways, my public health career really has been defined by leading and navigating in all of these new spaces, which I feel really set me up well. So when the opportunity to join Adams County came along, I was really excited about the opportunity and really energized just because of those past experiences that I had. And so now stepping into the director position is really humbling, but also very exciting. I've been working with this team alongside them for over 3 years now. So We've been growing and building the foundation of this organization together. And I know that the nursing division is a highly visible division to our community and our partners that we work with, which comes with a certain level of responsibility that I feel like I'm prepared to take on, because of those past experiences. So I'm really proud of what the team and has done and what we've done together, and excited to continue that.
Yes,
serving our community.
absolutely. And have I mentioned recently how excited we are that you're in this role? Not, we really are. Back to you, Dr. Bamberg. A lot of people hear health department and think vaccines or restaurant inspections, and we do that. But it's so much broader than that. And for someone who's never really thought of it before, how would you describe what public health is and why it matters every day?
Yeah, that's a great question. So where a provider like a doctor or a nurse might treat an individual person, public health is really looking at the health of a community. And so a community may be a county, it may be a state, it might be a city, or even more local than that. And so I would describe public health as being like the foundation of a building. So if you think about that foundation, you really want a very strong foundation in order to be able to achieve your best health possible. And so that foundation are things like having economic stability, having housing, being able to get an education. All of those things are a foundation for health. And so public health also works to address all of those things. So think things like food security or safe air and safe water. Those are the foundation of public health. And so in addition to vaccines and restaurant inspections and outbreaks, really that foundation of public health is really instrumental. And so we here at Adams work on all of those things so that we can support our community in the best way possible so that they can achieve their best health.
Absolutely. Absolutely. Thank you for that. Valencia, building on that, you've been working closely with the Adams County residents for a while. What have those interactions taught you about what people need from their local health department? What surprises them most about the kind of support we provide?
I think what surprises people the most is like what Wendy had just finished saying. Like we work on a lot of behind the scenes and a lot of those systems things, but really working alongside this community for the last several years, and these experiences have really revealed just a lot of different things. But mostly for me, what's coming up is one, that this community needs us to know what they're going through, what they're facing, and really truly understand them and what their need is, one. And then two, be able to respond and provide tangible and meaningful support for them. Like we're public health professionals, and but when we work with our residents, we do our very best to try and step into their shoes, and navigating paperwork, all of the barriers, wait times, just like knowing where to start with a lot of things. And largely a lot of us have lived this as well, so we really do get it. And I think that's really important. So we may not be able to solve every problem or have the resources or tools for every single thing, but working with our community and making a plan with them, following up, and showing them that we genuinely care about that outcome. That's something that people can see. That's something people feel. So public health, it's what we do together. And to Wendy's point, so just navigating those problems with our community alongside them, and meeting people where they're at and going to where they need us. Sorry, my voice is going out. Going to where people really need us and trying to help address and reduce those barriers that we know exist, using our voices and our positions in public health to advocate for changes that we know will make life a little bit easier for all of us.
Great. Thank you. Dr. Bamberg, public health is always changing, but at this moment in time, how would you describe the state of public health? What are the pressing issues you see, and what gives you hope?
Yeah, so I think the two words that come to my mind for this are both fragile and resilient. So I say fragile. Public health is at the moment a little bit like Jenga. So that's the game with the wooden blocks where you pull out the bottom one and you stack it on top and the tower becomes more and more wobbly. And I say that because public health has had a bit of a rough time. We all went through the trauma of COVID together, but public health definitely, there was some erosion of trust between the public and public health. And that's obviously, as I said before, like we all work together, right? As a community to build that health of the community, public health works with those communities. And so that loss of trust is really tough. And I think that public health is working really hard in order to gain that trust back. Additionally, each one of those pieces of that Jenga analogy, right, is a staff member who has a lot of experience or a certain program that has certain funding. And as we've seen, a lot of those things have eroded in the more recent past, especially with COVID and other factors as well. And so that's why I say fragile, but the resilient part is really about the strong community, right? Like we all want the same thing. We all want a healthy, stable community. And so we're all working on that together. And that really gives me hope. I work with some amazing people. I'm super happy to be working with Valencia now and amazing people at Adams County and across the public health network, which includes the state health department and public health folks at the federal level as well. And we're all working towards the same thing. We're just lucky enough to get to work in Adams County and work with our wonderful community so that we can really, again, all achieve our best health.
Great. Thank you. Valencia, what opportunities do you see for the Adams County Health Department?
Yeah, I think that we're still young enough as an organization to be really innovative and intentional in how we choose to grow. And I think there's a lot of opportunity in continuing to build on a lot of the work we've done to be really community-led and have that community-led approach to our public health. And public health, we know, works best when our community feels really connected to it, can see themselves reflected in the work that we're doing and know that their voices are actually shaping decisions and the work that we're doing. So that means us continuing to meet our community where they're at, making our services more accessible and responsive, but taking that a step further and creating intentional opportunities for our community to not just participate, but to lead and to influence our priorities and help guide the work that we're doing in the county. And then another opportunity is just internally, the collaboration happening across our divisions, and then as well as the collaboration happening with our community partners. Some of the most impactful work that we can do in public health is when we bring together different perspectives, different resources and talents and expertise around a shared issue that's important to all of us. Adams County Health Department has a really strong foundation of people who are really passionate about this work. And I think that positions us well to continue building a public health system that's really driven by the strengths, the expertise, and the leadership within the community itself.
Absolutely. We couldn't do what we do without those partnerships and without the community weighing in as well. We bring in a lot of community members to in focus groups and things like that. So we are ensuring that we are getting those voices heard in consideration of all the things that we do for the community. So thanks for mentioning that. Dr. Bamberg, public health isn't just vaccines, sexual health, and direct services any longer. How has it grown? And what direction do you see the role of public health taking in the future, especially here in Adams County?
Yeah, so things like vaccines, sexual health, response to outbreaks, all of those things are things that I think the community is pretty familiar with as the face of public health. But as we mentioned, it's a lot broader than that. And so things like safe air and safe water are really important to the health of communities. In addition, we've got programs here at Adams County that address things like food access, and we have a behavioral health program, as well as folks who address housing stability and access to healthcare. And so all of these things are really important to the public health of our community. The health of any individual really is not just about physical health, right? It's physical health, it's emotional health, it's social health, right? Those relationships that we develop, it's spiritual health. All of those things contribute to our health, and public health has a role to help support the community in all of these things so that everyone has the opportunity to have that best health that they possibly can. So that's really where I see us going as a public health community, but also in Adams County, again, working with communities, having the communities help us figure out where those priorities are. It's super critical.
Yes, absolutely. And thank you for mentioning all of those things that people can access, all the resources, excuse me, the programs that people probably had no idea that we do. So in wrapping up, immunizations, access to food, mental health resources, housing stability, there's so many ways that Adams County Health Department can help support you and your family, because ultimately, it's you, it's us together for a healthier Adams County. To learn more about our services, visit our website at www.adamscountyhealthdepartment.org or follow us on Facebook and Instagram. Until next time, thanks, Adams County.
That's a wrap for this episode of All in Adams. Thank you for joining us as we explore the people, programs, and the policies that make Adams County a great place to live, work, and thrive. If you enjoyed the show, be sure to subscribe and share with your friends, neighbors, and colleagues. Have a topic you'd like us to cover? Let us know. We're all in for bringing you the stories that matter most. Until next time, take care of each other and stay connected with us on Facebook, Instagram, Nextdoor, and X. We're all in Adams, and we're all in for you.